Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow, MD, and Dr. Thomas Grove, DO, from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Dr. Grove is a regenerative medicine specialist and an expert in ultrasound-guided injections with extensive experience as an athlete and strength and conditioning coach. Today's program could open up a new life without pain for you. To speak with Dr. Darrow and Dr. Grove, call 866-870-KRLA. That's 866-870-5752. Ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Regenerate, don't operate. Now, here's Dr. Darrow with his co-host, Dr. Thomas Grove.
Hello, everyone. This is Dr. Thomas Grove. Dr. Darrow's away from this week. This is Living Pain-Free, the educational program where we're talking about your musculoskeletal orthopedic needs. Anything from sprained ankles to joint arthritis, chronic back pain, neck pain, little fingers and toes, elbows, wrists, you name it. What we do is regenerative medicine. What we like to do is take the healing cells of the body and inject it locally where tissue needs to heal. It's very straightforward, but our whole goal and our whole mission is to get you back to being active again, hopefully avoiding an unnecessary surgery. I want to give you guys an opportunity to talk to us live here in the studio. Use a fake name if you need to. If you're driving, be safe and pull over. That number to talk to us live here in the studio, 866-870-5752. That's 866-870-5752. And if you give us a shout, we'll give you a copy of our book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, absolutely free. Even pay the postage for you on that one. And if you want to get a free consultation with our staff over the phone, give us a call. They're waiting now, 800-300-9300. That's 800-300-9300. If you want to check out some videos of us doing these procedures, check out the research we do in the office and hundreds of pages of educational content. There's a spot on every single page of our website to shoot us an email. Our website's www.jointrehab.com. That's www.jointrehab.com. And we've already got a caller coming in here. Let's get linked up here with Dawn coming to us from Newport Beach. Dawn, how are you?
Oh, hi, Dr. Grove. How are you?
Hey, I'm living life over here, man. I woke up today. Life is good. How are you?
Good. I wanted to see if you wanted to talk about my case because I called last Saturday.
Oh, yeah, Dawn. Yeah, Dawn's got a, this is a very classic. Yeah, very classic setup. I'm so glad we got to link up here through the radio and see in person, give you some treatment. Yeah, go ahead and tell that story one more time again. Where you're at with your knee, what happened, what brought you in.
Yeah, about 3 weeks ago, my right knee medial side was really painful. I went and got an MRI and saw an orthopedic surgeon. The MRI showed a couple of small meniscus tears and a sprain on the MCL. And then I found you guys because he was recommending surgery, and I didn't feel like I was in enough pain to warrant that. And I saw you on Wednesday, and I don't know if you remember my case very well, but it's you located, I think, some tears that were not even coming up on the MRI in some smaller, maybe ligaments or tendons. And we went ahead and did treatment, and I'm on day 3, and I feel really good. I think the hardest part now is the lack of activity and just the rest.
Exactly.
It's still swollen, not hugely swollen, but there's definitely some swelling in there. And yeah, I'm optimistic. I'm hoping that it helped with 1, maybe 2 shots. But do you want to talk a little bit about where those tears were? Because I actually had some friends and family when I explained this, and I don't know if you remember clearly, but they were like, "Well, what do you mean the MRI didn't pick up those other tears?" So
yeah, of course.
I thought maybe, yeah.
Yeah, very, very classic setup here, guys. So we talk about it every week, but X-rays, MRIs, CTs can be very useful, certainly, right? The downside is they are static images, meaning I can't really move the patient around as we're getting that image. My preferred modality today is the musculoskeletal ultrasound. So Don, if you remember, right, we're scanning you in real time when we brought you into that clinic, and we can actually see that tissue in real time, put some stress on those little ligaments, those little tendons. In addition to that, I'm just calling it like it is. It's higher definition than MRI today, so it gives us a lot of great information. Again, we combine that with a good hands-on physical exam. And so, Don, you're a really classic case where we find some extra things that the MRI didn't pick up on. And again, the physical exam tells us a lot more than a static image. And so, yeah, for your case here, we had a couple of things on the inside of that knee, so on the big toe, side of that knee, where we had a little bit of, stretched out ligaments, stretched out tendons. In particular, there's some ligaments. Remember, a ligament attaches a bone to a bone on that inner half of that knee. There's a couple of them. One's called the medial collateral ligament, which I think was kind of a big one for you, Don. Very classic sort of stabilizing ligament that you injure if that knee kind of buckles inward. And again, remember, you're kind of a big tennis person, so a very classic sort of tennis injury, lateral movement sort of thing that you need, right? It provides a lot of stability to that knee, make sure that we can move confidently as an athlete and also just as an everyday person walking, going up and down stairs. Right behind that, there's something called the posterior oblique ligament, which comes off that MCL. Little tiny patellar ligaments as well. So the kneecap has little ligaments that kind of keep it tacked down and tracking properly on the thigh bone called the femur. So we have a couple little things that were stretched out there. In addition to that, we had a little bit of strain of something called the pes anserine. That's where three little muscles cross the inside of that knee joint and attach on the front of that shin bone called the tibia. And so, yeah, my guess was at some point you had a knee kind of buckle inward, kind of stretch some of those structures out. And we have a couple little meniscus tears, but again, Don, not a big deal. Nothing that we certainly need to go after with surgery. And again, very basic sort of setup, right? Yeah, you come in, you get hands put on you, we get a proper physical exam, do a good scan with that ultrasound, and from there it's pretty easy, right? We just put that small needle directly where you're having those tender spots and make sure we're guiding that needle in with image guidance, and then from there you just rest. So like we talked about, I think I was texting with you this morning, the tough part is not going over with the exercise. Give yourself a good 2-week time period to let those tissues heal up and mature. So that's definitely the toughest part of what we do, is getting people to take a back seat to exercise just for now. Remember, for that knee, we can still do a lot of exercise for the upper body, though. Okay, so don't feel like you can't do absolutely nothing, but we want to stay off of the squats and lunges, the long walks and hikes, running, that sort of thing for a couple of weeks.
Yeah, and I feel really good. So that is the hardest part, because like right now, I think I texted you and said, well, can I go on a long neighborhood walk? And it was like, no, too much too soon. I think we're at 72 hours. So I will be watching a lot of Netflix.
Yeah, that's it. Doctor's orders, right?
Okay. Yeah, but thank you. It's feeling much better already. Like, this is like I said, I'm very optimistic. It's feeling really good.
Fantastic. Well, Don, thank you so much for calling and sharing your story.
Thank you.
Happy healing. We'll see you soon.
Bye-bye.
All right, guys, we'll give you an opportunity here to talk to us live in the studio. Let me give out that phone number again for you guys. We'll get some more callers coming in here. Number to call us live here in the studio. We can talk about any of your aches and pains, musculoskeletal, orthopedic injuries, any issues. Use a fake name if you need to. Number to call us live here in the studio is 866-870-5752. That's 866-870-5752. 5752. And if you give us a call, we'll ship you a copy of our book for free. The name of that book is Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Fantastic title. It's really what we're about here, right? We want to use the body's healing cells, stem cells and platelets, inject it under image guidance to these areas that could benefit from some healing, right? We regenerate that tissue, and hopefully we don't operate on it, right? We avoid these unnecessary surgeries, and we heal you the most natural and holistic way that we know. Remember, how we do this is these cells are just a natural part of what your body is, that normal healing cascade. The way I like explaining this to folks is think about, a set of dominoes, right? And that healing cascade is one cell talking to another, bringing in growth factors, bringing in these fibroblasts that are laying down collagen, right? Collagen's that base protein that makes up our musculoskeletal tissues, and we heal, right? It's not super complicated if you're explaining it in one sentence. Obviously, the healing cascade is very complicated, right? Lots of cell signaling going on. lots of PhD level cell communication. But at the end of the day, right, it heals tissue. We're just turning on the on switch for your body's natural ability to heal. Using the body's natural cells, right? All we're doing is taking those cells, concentrating them down. So it's a little bit more than what is usually there, which typically brings people in saying, "Hey, listen, I had an injury and I'm just not quite healing all the way." So what we do is inject what we call a supraphysiological amount of cells, meaning normally whatever is there, we're putting a little bit more than that, a little higher concentration, directly on target. Now we have musculoskeletal ultrasound, which is such an awesome tool. Like Dawn just mentioned, with her scan that we did for her, a lot of times we find a lot of things that MRI missed, X-ray missed, CTs miss because of the static nature of those sort of images, right? What we are able to do is use a dynamic evaluation, right? I can actually move that probe around, I can move the patient around, stress some tissues and see what's going on. And those are things that have a lot to do with being more accurate with what the true diagnosis is. And then from there, once we know where the heck that symptom is coming from, then we can introduce some cells in that area and get some healing going. So if you guys are ready to schedule a consultation with our staff for free, they're waiting by the line. That number to call is 800-300-9300. That's 800-300-9300. And if you want to check out our website, if you're too shy to talk to us on the radio, shoot us an email. A spot on every single page of our website for you guys to shoot us an email. That website is www.jointrehab.com. That's www.jointrehab.com. We've already got another caller coming in to us. Looks like we got Mark coming to us from Santa Monica. Mark, how are you?
Doing fine, doctor.
What can we help you with, sir?
I had my left hip dislocated a couple of years ago, and it seems to have exacerbated a problem I had. I had a sports hernia many years ago that wasn't giving me any problems. Now the sports hernia is right there in the inguinal, is giving me a lot of problems. And my left hip is giving me problems also from the dislocation.
Ooh, how did you dislocate the hip? That's pretty hard to do. Did you have like a big fall?
No. Long story short, I don't think I was holding down a log that my brother was cutting, and the log dropped before I expected it, and my leg went down and my body stayed up.
Yeah. Typically, those are pretty high velocity sort of mechanism of injury. Yeah, those can be pretty dang painful, man. Yeah, those are typically going to the emergency room. We're trying to pop that hip joint back in.
It went right back in, doctor.
Oh, good. Yeah, pretty lucky on that one. Yeah, sometimes those are really, really excruciating sort of experiences for folks. So anytime we have, this is a good chance to talk about joint dislocations. So remember, guys, anytime you have a joint that gets dislocated, a lot of forces involved with that. And remember, there's a lot of things, a lot of structures around that joint that allow that joint to stay where it's supposed to be, right, in the joint. And so when you have a full dislocation, or what we call a partial dislocation, which is a subluxation, a lot of times you stretch out those supportive structures. And I'm going to be honest with you, I haven't seen anything that comes close to getting people pain relief, decreasing the chance of having that dislocation come back, than regenerative medicine. Because what we want to do is we want to tighten up those structures again that were stretched out after a dislocation like that. And so for the hip, there's something called the hip joint capsule, and that's something that can benefit from the sort of treatment that we do. But those can be pretty, debilitating sort of injuries, a lot of lingering effects. Even though the joint, gets back to where it needs to be, a lot of times we'll beat up those surrounding structures from that sort of injury. So not unusual that you still have some pain, down the line. In terms of sports hernias, there's lots of things around that area that can mimic those sort of structures. We get a lot of groin pain that comes from where the adductor muscles, again, sort of those groin muscles, attach right next to something called the pubic bone, which is right around that hip joint area. Sometimes it's an abdominal strain. Sometimes it's a psoas major injury. That's a little hip flexor muscle. So there's a lot of things in that area that certainly can cause some issues. But yeah, the big thing for you, Mark, is bringing you in and doing a proper hands-on physical exam to determine exactly where that pain's coming from.
Okay.
Now, in terms of the symptoms that you have right now, is it just kind of more pain, achiness, or are you having anything else going on like, numbness or tingling or weakness?
No. Just
Good.
Pain and achiness, and a little instability in the hip.
Yeah. Yeah, so I can't say anything for sure, obviously, because I haven't evaluated you. But from what it sounds like, you'd be a good candidate to come in for a consultation. This is a very, very classic patient presentation that we have really good success rate with. And again, basically what we do, bring you in, proper hands-on physical exam. I'll give you a good scan with that ultrasound. It will determine where your symptoms are coming from. From there, simple set of injections, and we get you out the door. Again, a little rest period, and we bring you back in a few weeks and evaluate to see how you're feeling.
Great. Okay, that sounds good.
Fantastic. Anything else we can help you out with, Mark? Anything else bothering you?
No. That's it.
Fair enough. Well, hey, if you got a pen and paper, let me give you that phone number to call, and we'll get you a consultation, okay?
Okay.
That number to call is 800-300-9300.
800-300. 98.
9300.
9300.
You got it.
Okay. Got it. Thank you.
Mark, thanks so much for the call. Hope to see you soon.
Thank you.
Of course. Yeah, some great talking points there, guys. But, in terms of joint dislocations, I'm thinking back to my team physician days. I was a team doc for years for Division I colleges. I got to, have a very fortunate training where I was, able to treat a lot of professional athletes, a ton of Division I athletes. And, when you're a high-end athlete, especially contact sports, joint dislocations, those are things that just happen, right? It's kind of part of that game. Not necessarily having to be a high-end athlete. Lots of folks have joint dislocations as well. You take an awkward fall, right? You get in a car accident, all kinds of things can happen. And when those joint dislocations happen, in our, typical model, right, we do that x-ray. Is the joint where it's supposed to be? All right, great. And then we, get you out the door and get you back to living life. Now, the problem with that is a lot of times folks have a lot of lingering pain, right? Like Mark was describing, that sort of feeling of instability. That kind of feels like the whole joint isn't quite, stable enough when I put some stress on it. So for a hip dislocation, a lot of times it's in that position of deep hip flexion. That's like when you're squatting down to pick something up off the ground, lunging, squatting, those sort of things. And it just kind of feels a little wonky, right? Feels like it's going to maybe pop out again. We see a lot of shoulder dislocations, a lot of finger dislocations as well, where if you're trying to do maybe some overhead pressing, some bench press, the shoulder just doesn't quite feel like it's supposed to be where it is, and it might pop out again. And so the best thing that we can do is bring you in and evaluate you and see if maybe there's some ligaments that are either torn or stretched out, maybe some muscles that cross that joint that provide some stability. And then at minimum, after joint dislocation, I like treating just the joint capsule. Remember, the joint capsule is like a little balloon, like a little covering that covers up all of our joints in our body. We got them all over our body. And these are things that provide a lot of stability. And when they're stretched out, even though the joint, on an image looks okay, it looks like there's no big problem with the cartilage or, fractures or anything. If that capsule's strained, man, it can be really painful, and it can also lead to joint instability, which is not a very fun feeling. But again, when I was back with a lot of these sports organizations, I'd be the guy in the medical tent, right? You ever watch those football games and you've got somebody who went down with an injury and they go to the sideline, they go to that medical tent. I was that guy in that tent checking you out, popping that shoulder back into place. We finished that game out, and then from there, what we can do is get some treatment going, right? So we put some cells right into that shoulder socket, that hip joint, the ankle joint, finger joint, whatever it is, in addition to the little shots around that joint, and we get some more stability. So really, really great treatment, very safe to do, and decreases that chance of having that joint come back out. So want to get some more callers coming in here, guys. We'll give you the number to the live call here in the studio. Number to call us is 866-870-5752. That's 866-870-5752. And if you want to get a copy of our book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, we can give that to you for free. We can pay the postage for you on that one. Just give us a call. And if you want to schedule a consultation with us for free over the phone, you can give us a call. Our staff is waiting right now by the line. That number to call is 800-300-9300. That's 800-300-9300. And if you want to check out our website, great place to start. We've got hundreds and hundreds of pages of articles, educational content, pictures of us doing these procedures, videos of us doing these procedures. And there's a spot on every single page for you guys to shoot us an email as well. Email is a great way for us to communicate with our folks to see if regenerative medicine might be a good idea for you. We can give a lot of great information, a lot of great redirection for more education. Just through email, right? We answer emails every single day, morning, noon, and night. So make sure you're using that as a great resource for you. That website is www.jointrehab.com. That's www.jointrehab.com. So again, a lot of times it's just a lack of knowing that this is a real option for folks. That's why we do things like the radio show. We do the website. We take a lot of phone calls, a lot of texts, a lot of emails. We actually give our cell phones out to every patient that comes in the clinic. We're passionate about this work. We want to get people to understand that, regenerative medicine, it's not a cure-all, certainly, right? We're not, making those sort of claims. But for your run-of-the-mill musculoskeletal injuries, for things that you're considering elective orthopedic surgery for, I think it's always a good idea to see if regenerative medicine might be a good option for you, because many times it is, right? We see, unfortunately, a lot of these surgeries are just not needed, right? And then we suffer the complications of having a surgery when we could have just done a simple set of injections and hopefully get you back in the game. So we got another caller coming to us here from Long Beach. Long Beach, we've got Thane. Thane, how are you?
Hi. How are you today?
I'm doing great. What can I help you with, sir?
I played hockey for 30 years, quite competitively. Dislocated my shoulder a multitude of times, snapped it back into place when I was younger. Now I'm in my late 50s, and I got hit by a car on a bike while I was walking a dog. And my goodness, I went to the hospital 4 days after thinking I was, I would heal myself, you know what I mean? And then all of a sudden, they gave me an x-ray. They said nothing was broken. So I went off to the chiropractor to see what he could do for me. I've been to 2 sessions, and he sort of popped it around and did some stuff and stretched it all out. And I've been trying to cradle my arm towards my rib cage, that typical feeling when it's dislocated. I'm getting a little bit more motion. I can lift my arm up in the shower to, rinse off. I'm starting to be able to reach the heater button, but I just can't do anything with I just can't use my muscles, and it's been 5 weeks now. And it feels like the joint I've never felt this type of joint problem before after many knees and shoulders being beat up over my past. I've just never felt this pain.
Oh, man, I'm sorry to hear that. Yeah, Thane, it's a tough set of injuries that you go through as a hockey player. I talk about it a couple of times, but I used to be a strength conditioning coach, nutritional specialist for professional athletes. So I used to pick up contracts, a lot of NHL players, guys that get their contracts picked up in Europe. I'd actually go live with them, do all their cooking, all their training. So I'm very familiar with the hockey life is life, and it is a traumatic one, man. Those are some tough dudes. And again, a lot of times you have, a fall, and you got to play through that pain, right? You're getting through yourself through the season. So very, very classic situation with shoulder dislocations. We were just talking to an individual with a hip dislocation, previous caller here. But shoulder dislocations, a lot of times that shoulder capsule will get stretched out. The rotator cuff, which is a set of muscles that crosses that joint, those can get stretched out, sometimes torn. There's a lot of ligaments too. There's a ton of ligaments in that shoulder that can benefit from tightening up and healing. And so shoulder dislocations, I really haven't seen much that works other than regenerative medicine to get you in a good position, right? Once that shoulder's back where it needs to be in the socket, now what we want to do is reinforce it, right? We want to tighten up that capsule, tighten up those supportive structures, and get you back to moving again, right? Are you able to do any sort of exercise of that shoulder, bench press, shoulder press, anything like that?
I'm going to start doing a few push-ups here today, trying to get it back in just see how much pressure I can. I got to lift a bunch of boxes to lift them up high to clean up my garage and stuff like that. I'm going to really attempt it and see how far I can take it. And hopefully, I can work it out. That's really my goal today. And then I'm going to see, but I've been limited since February 1st when it happened. So definitely this is the first time I'll be trying to put any pressure on it. It seems like the swelling or the inflammation or the muscle tightening or whatever it's been, it's somewhat dissipated, and I've got a little bit more motion. I just can't seem to, I just struggles just to reach the volume switch on my car when I'm driving. You know what I mean? It's just, I just can't seem to it's mind over matter to make it move.
Oh yeah, yeah. And shoulder injuries, man, that can be very debilitating. And I'm very blessed because I got to see people that are injured every day. But I always talk about this is so cheesy, but just like defaulting to gratitude and being thankful that we have bodies that work. Because I promise there's someone that's always worse off. So when you have an injury like that, man, it can be something that's very debilitating. So hang on the line here. We can chat a little bit more. And Judy, I see as well. We'll catch you guys here after the break. This is the end of the first half of our show. This is Living Pain Free. I'm Dr. Thomas Grove. We give you guys that number so we get some more callers coming on the second half. That number to call is 866-870-5752. Check out our website, www.jointrehab.com. See you after the break.
You're listening to Living Pain Free with Dr. Marc Darrow and Dr. Thomas Grove. Their practice is located at the Joint Rehab and Sports Medical Center in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow and Dr. Grove will be back in just a moment. Stay tuned.